let's start. So guys, today topics, as you know very well, is feline acne, and it's a common problem. For example, if we look at the large study done at Cornell University, that's USA, right? They they went through all the feline cases that came because of skin problems. Together there were, you can see the number on the slide, 1,407 cases. And guess what? Feline acne actually got into top 10 feline dermatologic diagnoses. Look, it's right here. Between fleas, flea infestation and flea bite allergy, and we all know how common is flea infestation and flea allergy, right? So it's a common common disease. But when I went to PubMed to search to look for articles about feline acne, guess how many I found? I found two. And one of them was from 26 years ago, and another one from 17 years ago. Two papers. So no wonder we have so many questions about what to do with feline acne cases. Okay, so what is it, this feline acne? It's a condition that restricted to the area, to one area, so it's localized disorder, and it just chin and lips. That's all, right? We cannot call acne similar skin lesions appearing somewhere else. So what's so special about this localization? We know that on the chin and on the lips we have quite large and very active sebaceous glands, so oil glands that produce sebum, and on the chin this family of large active sebaceous glands is having their own name, and they're called submental organ. And we know that at least at males, sebaceous glands activity depends very much on testosterone. So there were studies actually done that they compared activity and size of sebaceous glands before castration in males and after castration, and it was like huge difference in activity. So testosterone in males at least plays a great role. But spoiler, there is no uncastrated intact male predisposition for the acne, not at all. So how they use this submental organ? Sebum is rich in pheromones, so everybody of you seen multiple times how cats mark their territory, they rub with their chin, with their lips against different objects, and not only objects, against owner as well, in order to mark their possessions, their property, right? And what do we know about feline acne? We know that there is no age predisposition, and there is no similarity actually with human acne. With human acne, it's mostly seen at teenager age, with many hormonal changes. It's not like that in cats, vice versa. We can say that majority of the cats will get it after they are 1 year old. So we don't see it in growing cats or kittens, right? There is no sex predisposition, as I said, no difference. Are you female or male? Are you intact or not? They all get it about the same amount. And there is no breed predisposition. In one article, Persian cats were kind of mentioned, but other larger studies, for example, this study done at Cornell University, they had like 74 acne cats, and there were no Persians at all. So we know that if we look inside, and there are histological pictures of acne, if you look inside that skin on the chin, there is a lot of keratin, so follicular hyperkeratosis, and on this left picture you can see a very enlarged infundibulum of the hair follicle filled with keratin. So keratin, you know, dead epithelial cells with keratin and sebum, right? So it's histological representation of comedone, actually. And here on the right you can see multiple next to each other sebaceous glands and their ducts described by histopathologists as also enlarged, so very active. A lot of keratin, a lot of sebum. And of course, if this hair follicle will be ruptured, so will be broken, it cannot hold forever. Usually it cannot hold forever this excessive amount of keratin and sebum. If it ruptures and everything from the hair follicle goes exactly to the dermis itself, there will be strong foreign body reaction and inflammatory response, furunculosis. It's not necessarily infected from the beginning. It could be sterile furunculosis, but of course, when these furuncles form and there will be draining tracts and there will be infected, usually with staphylococcus. And what is interesting that histologically there is not only signs of folliculitis furunculosis, but also in many cases sebaceous glands will be inflamed, so there will be sebaceous adenitis. So what is triggering that lots of keratin and lots of sebum production? Actually, the answer is we don't know. It's idiopathic condition still. We don't know the reason. A lot of reasons, possible reasons were proposed. For example, calici or herpes viruses, because there will some massive outbreaks described in some categories. So herpes and calici, they looked for it, but they didn't found it. And there is no other infection apart from secondary infection. So there is no primary infection. Stress, because of this contagious category, multiple cats in categories affected, was also suspected, but it was not proven. At least in cases they were looking for stress reasons, they couldn't prove it. No proven allergy, although at this large study, not study, but retrospective study they did at Cornell University looking for skin diseases in cats, they found that amount so there was 30%, if I remember well, 30% of acne cats, they had allergy as well, but they're probably not related because there were a lot of allergy cases and probably just coincidence. So as I said, there is no primary reaction, primary infection, sorry. Acne, inflamed acne will be infected, usually with Staphylococcus pseudointermedius, sometimes with Staphylococcus aureus, Streptococcus, and some other bacteria less commonly, but all these bacteria are secondary. So you treat them, they are gone, but there are still lots of keratin and lots of sebum, right? And you've probably heard that plastic food bowls are frequently blamed, but the truth is when you change it to metal bowl, usually nothing happens. At least I don't see any huge difference. And at this Cornell study, university study, they changed bowls from plastic ones in 25 cats with acne, but no improvement was seen after that. So you may comment what's your experience about it. So how it looks clinically, I would divide probably different stages, different clinical representations of acne into 3 clinical pictures. So this one is what owner describes as chin is dirty. So this dirt and the chin are follicular casts. It's quite a benign form of acne because all this keratin and sebum is going out of the hair follicle. That's what we see on hair shafts or sometimes free already not attached to the hair shaft. So it's quite benign condition. Of course, it could be together with comedones, but in some cases it's just follicular casts, and it's easy to take care of it. Then comedones, blackheads, as owners would describe them. You see here just one large one on the chin, and maybe on this picture it's not so much visible, but there are multiple small little ones on the chin. This condition is already a bit worse than just follicular casts because hair shaft is plugged, is closed with this mixture of keratin and sebum, so it's predisposed to rupture, and we know if hair follicle ruptures, there will be furunculosis and there will be severe inflammation, right? And there is a clinical picture number 3. So folliculitis, furunculosis. First 2 clinical pictures are, we can call them asymptomatic. They are not painful or pruritic or anything or inflamed. And this one is, of course, quite painful. Furunculosis is always painful, and cat may show signs of discomfort, rub on the chin with the paw. Sometimes lymph nodes are enlarged, etc. So what may look similar to acne, but it's not exactly acne. Chin can be enlarged because of eosinophilic infiltrate, so-called eosinophilic granuloma. Sometimes it's called fat chin because it's enlarged and shiny, but it's not acne, and it will be responding to immunosuppressive treatment, to corticosteroids, for example, and there is no comedons and no follicular cast, so there is no follicular hyperkeratosis, just inflammation in the same area. Allergic cat may scratch at the head, at the face, and also at the chin and lips, and cause similar signs. So, for example, here you can see self-trauma consequence, erosion, probably some ulceration, and some black stuff here on the chin, but it's not actually follicular casts. And look at the same chin a few weeks after treatment with prednisolone, everything is gone. This example is not exactly differential for acne, it's just differential for idiopathic acne. So it's actually acne with comedons and follicular cast, but it's not idiopathic, it's due to follicular mite, the Modex cati. So it's one of the diseases that should be actually excluded in cases of acne. So follicular mite obviously causes irritation of the hair follicle, and there will be more keratin production and the same result. And another cause for acne, fungal infection, dermatophytosis. Look, this is a Persian cat with dirty chin and lips, and in this one dermatophytosis was diagnosed and everything was gone after antifungal treatment. So how to diagnose acne? It's easy. We can diagnose it in most cases with just clinical examination. I would recommend you to exclude the Modex as a cause for acne, especially in older cats when there will be possible causes for immunosuppression, right? Scraping is mentioned here, but we all know it's not easy to scrape cat and especially cat chin, right? So trichogram may be the best way to check hair follicles for the Modex mites. If you have a reason to suspect it could be dermatophytosis, what kind of reason? For example, some other localizations involved in alopecia, follicular casts or scaling or inflammation. What else? Maybe it goes a bit further than lips and chin, like in this Persian cat I showed you, right? If you suspected but you didn't find infected hairs with trichogram, maybe it's wise to proceed with fungal diagnostics, at least with wood lamp, maybe with fungal culture or PCR or both. If you take cytology from inflamed areas, you will find pyogranulomatous inflammation. What does it mean? There will be neutrophils, also lots of macrophages. You can see here. It's not, I have to admit, it's not from acne case. just representation of pyogranulomatous inflammation. So lots of neutrophils, and then these large different size cells are macrophages, and maybe occasional eosinophils, and you may find bacteria. Mostly it will be cocci, right? So you're probably interested more in treatment of feline acne, how we should treat it. Some cases it's just wise to leave without any treatment. So if there is some small comedons and few follicular casts on the lips, it may stay like that for years or forever, and maybe you may do worse, just trying to rub it with some, I don't know what, cleaning it, or try to wash it, etc., etc. If it's not inflamed, it's totally justified to just leave it alone and see what will happen. In lots of cases, nothing will happen, right? If this chin is not inflamed but very dirty, and owner is motivated to get rid of this dirtiness, right? You may advise some gentle cleaning. Gentle is a very important word here. Why? Because if you will rub, or owner will rub on this area, it will be easily irritated, and these sebaceous glands and follicular hair follicles will produce even more sebum and keratin. So it's very gentle. It's not like rubbing, it's like moisturizing this area and removing step by step, not trying to do it in one day, all these follicular casts. Sometimes it's not just water what you need. It's better to use some oily things like Vaseline oil or Vaseline ointment. It dissolves actually quite beautifully these follicular casts and make them very quickly soft, and you can remove it easily. Or you may use, for example, a gentle cleaning with some ceruminolytic agent, I mean some ear lotion, because it's also kind of designed to dissolve cerumen, and cerumen it's keratin together with sebum, right? Mostly. So gentle cleaning. I'm not a particular fan of shampooing the cat, especially chin of the cat. I don't know how many owners will be able to provide this kind of treatment, so I usually don't try to suggest that, and I don't believe that it gives so many advantages that you should necessarily try to wash your cat who doesn't want to be washed. So I'm not a shampoo girl or woman. Um, of course, maybe there are some cats, Persian cats, who doesn't care what owner does with them. Maybe then shampooing the chin sounds like a good option. If the chin is inflamed, but it's kind of mild inflammation, one furrow here, another there, maybe it will be enough to control it with local corticosteroid and antibiotic. Sometimes I may use some ear drops. Okay, there is also antifungal element that we don't need in this case, but I don't care. I just use this antibiotic and corticosteroid in this ear drop to control this mild version of inflamed acne. Sometimes it's not enough, just local treatment. And then I would advise systemic corticosteroids. I put systemic antibiotics in brackets because usually you don't need them. Honestly, although most of these cases are secondary infected, you can deal with this infection locally, and the main cause of inflammation, the main driving force behind this furunculosis is actually this foreign body reaction to all the keratin from the ruptured follicle. So corticosteroids may deal with that just beautifully. So after this inflammation gone, usually nothing happened with these comedones, right? And some comedones will be predisposed to be a source of this inflammation again and again. Should we remove them? Should we squeeze them out? I think in some cases it's justified. Of course, don't let owner do that. Do it in the clinic. The cat, of course, will need sedation, and then you kind of try for some time to dissolve this keratin plaque with again serum analytic. Usually there is some ear lotion in the clinic, right? And then you try to open it gently with the needle, sterile needle, and usually after it's opened, remaining keratin will be soft enough to go out when you squeeze it. For squeezing, I would use two cotton, how you call them, cotton? You understood me, right? I just place them on both sides of comedone and gently squeeze this comedone out. If you are advanced clinic, you may try to laser these comedones out. Usually there is not like hundreds of them. Usually there will be like I don't know, 5, 7 large ones that cause the problem. You can remove them forever. Like these follicles will be gone. Retinoids, so synthetic vitamin A, is known as agent able to suppress keratin production. They are not studied in cats with acne. You may try local retinoids. For example, I tried in some cases tazaraten. It's of course a human product, and it works. It may maybe not get rid of huge comedones. It's better to squeeze them out, right? But it will prevent appearing of new ones. I've never used myself systemic retinoids in cats, but it's mentioned in some sources. I cannot share with you experience about that. So what about this study that is showing mupirocin efficacy for acne? Mupirocin, you all know, it's antibiotic. A local one, there is no systemic mupirocin kind of antibiotic. It's quite exclusive. It's effective against gram-positive, but not gram-negative bacteria. Of course, it's very effective against Staphylococcus, and it's very effective against Staphylococcus resistant to oxacillin and methicillin. So it's not quite understood why mupirocin in these cases. There was 25 cats with acne, and majority of them, not all of them, had a good response after 3 weeks of mupirocin usage, right? It's not quite clear. Is it only antimicrobial action? Because mupirocin ointment, right? There is ointment and cream. Ointment, there is also propylene glycol, and it's a good not only antimicrobial, but also something that may beautifully clean this area, right? And recently, there is, you can see it on my screen, recently other useful property of mupirocin was described. Look, mupirocin was proven to promote wound healing because it stimulates growth factor production and proliferation of human keratinocytes. Anyways, as I said, this is an old study, and mupirocin now is regarded as a very important local antibiotic to treat and prevent in humans methicillin-resistant Staphylococcus aureus. And you can see on this picture, mupirocin is applied in nares, for example, to prevent carriage of this resistant Staphylococcus. So I think it's not my own personal opinion. It's kind of recommendation of how to say, careful use, guidelines for use of antimicrobials, antibiotics. So mupirocin should be left alone, should be left for methicillin-resistant staphylococcal infection cases. In humans will have the priority, and it should not be used for cats' acne. Other antibiotics can deal with it very beautifully. So I think that's all from my part. Let me see your questions or comments. I don't see any. So guys, share your experience, how you treat feline acne. And for example, I'm curious if in your cases, this bowl, plastic bowl changed to metal or ceramic was working, etc. There is a question, Isabella, do you recommend chlorhexidine gel? I may recommend chlorhexidine wipes because I just like wipes. It's something easy to use. You just take it out from the package and you clean the area with it. I guess gel would work. I'm not sure how much chlorhexidine is useful for that cases, because in light cases, when we have just comedones and follicular casts, I believe that it just for cleaning purpose, these wipes or gel, right? They are not like, there is no antimicrobial effect needed yet if there is inflammation. But if there is inflammation, I mean furunculosis, usual chlorhexidine will not be effective. You need, first of all, anti-inflammatory drug. You need corticosteroids in furunculosis. That's what you need. And then some antibiotic. I don't think chlorhexidine will change a lot if you use it like solo, right? Again, Tanella is saying that um, she had cases when she changed plastic for metal and it was okay. Arina, recent patient, did very well with wipes, chlorhexidine wipes. The owner was very happy with the results. So Arina, what case was it? I guess it was just follicular casts case, so dirty chin, probably not furunculosis case. Elizabeth, is chlorhexidine irritating for cats? I wouldn't say so. It may be irritating, but for dogs as well. I didn't notice that it's more irritating for cats, but again, I'm not using it that much in cats, so can't really answer. Antonella Zincosept spray and Epsom salts probably, but not so good in local therapy. Yeah, it's not too easy to apply some spray on the cat chin, right? Zincosept is also chlorhexidine spray, right? There is some other components, but if I remember well, chlorhexidine is a main one. Anna, how often do you recommend treating the chin with ceruminolytics or oil? You mean how often to do that, or how often do I propose that treatment? I guess it's first one. So I would not do that many times per day. It would be probably once a day, maybe even alternate days, so every other day. But I would not do that for prophylactics, just to be clear. It's more for cleaning already dirty chin. For prophylactics, I would it would depend very much on the cat, but I would say like once a week or every other week. Arina is commenting that yes, it was just dirty. Arina was saying about good results with chlorhexidine wipes. Celine, I have used topical chlorhexidine in the past. I agree it's not super useful and can be in the mild cases. Ligita sulfargine ointment. So sulfargine is also antibiotic, silver sulfadiazine. I agree that antimicrobials can be helpful, but I would not put all my attention in antimicrobial treatment. As I said, in dirty chin cases, you don't have infection yet. In inflamed furunculosis cases, it's more about foreign body reaction, and you need even more corticosteroids than antimicrobials. And sulfargine and chlorhexidine, I think they are mostly working in dirty chin cases, but probably not. Okay, not probably. I believe that not because of their antimicrobial properties because there is no infection yet, because they are just as a cream or as an ointment or as a wet wipe, they're just cleaning this chin. It's my belief, right? Isabella, for dirty chin, shave the chin and clean with ear serum analytic. Yes, serum analytic is good. Squalene, for example, is very gentle and good resolving cerumen and keratin resolving features. I would not shave the chin. I don't like shaving. And every shaving, there is a very short hairs in most cases, right? In furunculosis, there could be alopecia, right? But anyways, I don't like shaving. I don't think we need shaving. Maybe for some exception in Persian cats, but otherwise I would not shave the chin. Antonella, I use cyclosporin associated with local therapy and it's almost okay too. I guess cyclosporin may reduce the inflammation, right? But I think corticosteroids are much quicker, cheaper, and tolerated better by cats. Does it make sense to use local ear drops? Yes, I was just talking about them. In a lot of cases, I would, in a lot of mild folliculitis, furunculosis cases, I would use topical ear drops. Celine, have you got any preferred serum analytic product? Not really, but I mentioned squalene, and I like more like oily preparation. Sometimes I even suggest owners to buy for chin cleaning human serum analytic. They are in the pharmacies without any recipe. I don't remember the name, but I think it would not be useful if I say the name of a product that is sold in Estonia. You probably have your own products. You may try them. A lot of them will be very gentle on the chin. Yes, I guess epiotic may do the work. Sandra is using gentle cleaning with chlorhexidine, then application of predniderm, prednisolone and neomycin, plus ceramic bowls, plus tablet of Credelio, Lotila you give, Sandra, you give Credelio just to be sure it's not the Modex, so why do you give Credelio? But you treatment plan sounds very good for me. Everything about it, gentle cleaning and then local corticosteroid and antibiotic. It will work, yes. For how long do you prescribe steroids and what is preferred one? If we are talking about systemic steroids, my first choice is prednisolone or methylprednisolone. I would use quite a small dosage. I think it's okay for cat, just 1 milligram per kick per day. And I would use, I think I would ask them come back in 2 weeks and see if they need more, or I can just continue with local ones. Usually the answer is quite quick. You don't need more than 2 or 3 weeks of systemic corticosteroid. Celine, thanks. I was thinking to one with squalene, which I like a lot for is too. Yes. To squalene is almost never like any contact reaction. I like it. It's very gentle. cats especially. Arina, do you use Cortavans for local therapy? No. Because you cannot spray it, right? And then it's complicated to apply it without spraying. And for the chin, I'd like something a bit oily, like Mitex or Suralan, because it's also cleaning this area. Okay, it sounds controversial how this oily thing is cleaning the area, but it kind of resolves all these follicular casts and sometimes even plaques of keratin, so comedones, and it's more gentle than Cortavans. But I don't think Cortavans will do harm. I think it just not so much appropriated in this localization and in this case, especially if there is not only furunculosis but also dirty lips and chin, etc. Okay, guys, do you have more comments or questions? I have an announcement for you. This week on Saturday, series of breed dermatosis will be started. I start with Labrador, but until the end of the year there will be 10 breeds, 9 of them dogs and 1 Sphinx cat, and I will be talking about some common and not so common and even rare dermatosis that this concrete breed is predisposed. And one webinar will be 24 euros. It's very affordable, but until this Friday, so during these 5 days, you may buy all 10 of them for very good price. So it's time limited offer. All 10 of them will be 175 euros, and I will give a link to registration and payment right after we end this session to Facebook group. So if you are interested, go to the group afterwards, find this link and join us. I promise it will be fun and educational. Jasa, will there be recording available? If you are asking about this acne stuff, I guess so, because Facebook is usually automatically saves the video, save the recording. If you are asking about breed dermatosis, of course, recording is always available and sent usually the same day after the webinar. Elena, can you share a brand name for this product with Squalene, please? I will do that. Let me write that down. I will do that in a group later because I don't remember. Okay, guys, I hope you liked our discussion and learned something new and will try something new. Thank you very much. And see you in the group or elsewhere. Have a nice evening. Hug you all and goodbye.